So I want to start with Keely. We're all hoping that the coronavirus vaccine is the light at the end of the tunnel. People want to be able to do things, go out to bars, hang out with friends, but as we've seen, this process has been shaky at best. One major issue has been the intense race for a vaccine between different pharmaceutical companies, and in turn competing countries. So now we have a number of different vaccines that have been approved, and the rollout of those vaccines has been started. But most countries are behind their target in the pace for vaccinations. And there are reports of waste and even doctors giving out vaccines like unauthorized and getting reprimanded for it. But Keely, can you talk a little bit about why there has been so many issues with this process? It doesn't seem like it should be that difficult.
Yeah, I mean, it shouldn't. And the sort of great news of 2020 was that all of a sudden, all of these like revolutionary new vaccines came onto the market. They're using this brand new mRNA technology that is, supposed to basically be cheap to produce and easy to scale up and all of these things. And yet somehow, even despite all this innovation, it's likely that the majority of the world's population won't get vaccinated until 2024. And if you live in a country like Israel, like you guys were talking about earlier, where, a huge amount of the population has gotten their vaccine comparably, it can feel like, oh, well, who cares about the rest of the world, essentially. But as long as the virus is allowed to circulate in any part of the world, the rest of the world is threatened because it can mutate, it can outsmart vaccines, and then it can enter even, borders that have the highest rates of immunization. And so it's in the interests of the capitalist class to get this under control, but using all of their traditional sort of neoliberal approaches isn't enough to get them out of this, because exactly what's hampering our ability to carry out mass immunization is for-profit based competition between big pharmaceutical companies. And so you had, these great new vaccines come onto the market, but then wealthy countries literally cleared the shelves of them. And so what's left is way fewer doses of less effective vaccines to basically be distributed among countries that make up the majority of the world's population.
Yeah, I mean, you're talking about like the light at the end of the tunnel, and I think it's becoming almost as much as a cliche as the words like unprecedented and crisis, right? And obviously it's such a huge relief that it could be over. But yeah, it's not that simple, because it's not just the process of developing the vaccine, but then also the production, distribution, and actually administering the vaccine to, 8 billion people. And at each of these stages, the question of who is in control and for what purpose really comes to the fore, because it's actually in this anarchic way, being administered for the purposes of profit and the maintenance of the profit system, and not human lives and health. And even the fact that the vaccines were developed so quickly, which I think is a testament to modern science and our technology and the ingenuity of the best immunologists. But actually, they were all developed so quickly because of the huge amount of public resources poured into pharmaceutical companies, particularly from the US government, the UK government, and other governments around the world. So the US Health Ministry alone committed over $10 billion to vaccine developers. And all of these companies, as well as having direct public funding, also are benefiting from the fundamental research, which is kind of more general scientific exploration that is developed at public universities as well. And yet they stand to profit and make billions, like Pfizer, BioNTech stands to make 15 billion from the profit of their vaccine. And these private companies retain control over the price, the quantity produced, and who they're going to sell it to. So there's this idea that the capitalist system is so efficient and promotes innovation, yet at the same time, they're just reaping the rewards of this system of like corporate welfare, rather than providing for the needs of people. And even with the AstraZeneca vaccine, there are huge shortages now, which are having a real impact on the EU. AstraZeneca has reneged on a deal of tens of millions of vaccines to the EU due to these vague manufacturing problems. But the point is that it's actually restricted due to international property laws, that it's only licensed to certain manufacturers. Well, why not take control over factories and produce on a wider scale? Why not employ some of the unemployed workers, many of whom have technical skills, to be producing these vaccines? Yeah, it kind of reminds me of the example from last March in Italy, where there was a shortage of ventilators, and the manufacturer produced them for $11,000, but then volunteers 3D printed a valve that worked the exact same, that cost $1 and saved 10 lives, and yet was threatened with legal action for breach of intellectual property laws. So it's just kind of showing that this intellectual property laws and patents are such a barrier to actual provision for human health